Hi, my name is Kathleen Kobashi, and I'm one of the urologists here at Houston Methodist Hospital. Urgency, got to get to the bathroom, I can't quite get there in time, and urinary frequency. That's called overactive bladder. If you think of the bladder like a big balloon, and you think of the knot as the valve muscle, any defect in this system can result in urinary leakage. When you feel like you gotta go right now. And sometimes you just can't quite make it in time, which can be quite embarrassing and a real quality of life problem for many people. That's a problem actually with the balloon. So the balloon is squeezing when it's not supposed to, or the balloon is really stiff, or it's just that the balloon is more sensitive, the bladder is more sensitive, so it feels like it has to go at a lower volume than it should. I think the most important thing is to think about what the mechanism or the cause of overactive bladder is. So that being lack of estrogen, aging, time, gravity, or dietary irritants, meaning caffeine, alcohol, those are the most common culprits, sometimes tomato sauce. That's the same for men. Men will get overactive bladder because of dietary issues. And for men also because the prostate gets in the way. So how does that cause overactive bladder? Well, if you think about the prostate and the position of it, it's like a donut around the tube that you urinate through. So if the donut gets bigger, the hole gets a little smaller, and the bladder has to compensate by squeezing harder to get through a tighter channel. Over time, the bladder starts to get in the habit of getting overactive, and so that's why that's a mechanism for men. The prevalence of overactive bladder has been estimated to be upwards of 100 million people worldwide. But that may very well be an underestimate because many people don't want to talk to their doctor about it. But you should talk to your doctor about it because there are treatment options that are available. So the exciting thing is that we've got a lot of great and successful options that are all minimally invasive to treat overactive bladder. First-line therapies are dietary modifications, so avoiding things that irritate the bladder like a cup of coffee or a glass of wine. Not everybody is affected by dietary irritants, but those are sort of low-hanging fruit if you can go to decaf or, avoid alcohol. However, you don't have to avoid it altogether. You just want to be strategic about it. So if you're getting on the airplane and you've got the window seat, you don't want to get on with a big old cup of coffee. If you're going to the movies after you've had a glass of wine, you probably don't want to sit in the middle of the middle row. So I think that it's important to think about the things that can contribute to overactive bladder and change that lifestyle. And then what we call urgency suppression techniques. So when the urge hits, you can think of what you're going to make for dinner tonight or what your foot feels like in your shoe, something like that. Just something that has nothing to do with your bladder and it buys you a little time to get to the bathroom. We call that the garage door syndrome, and anybody who experiences it knows exactly what we're talking about, that you can drive home the last 10 miles having to go to the bathroom, but you can hold it. And then as soon as you put your key in the door or push the garage door opener, your bladder just runs with it. So if you can divert your attention a little bit, that's a very effective exercise. The other thing that you can do conservatively is a thing called quick flicks. So basically what that is the Kegel exercises or the building your core exercises, but do them quickly. And that actually backs up the curve a little bit so the urgency subsides just long enough to give you a little time to get to the bathroom. Second-line therapies include medications. So there are medications that can relax the bladder. Very well tolerated overall. Sometimes the side effects or the cost profile are things that are limitations for those medications, but they can be very effective. We can also give vaginal estrogen, and that can help replace the local estrogen that can be helpful for overactive bladder. When medications and exercises and dietary changes are not effective, there are third-line therapies that have become very much the mainstay of our therapy options and are very effective. The first one, in no particular order, is a thing called PTNS, which is posterior tibial nerve stimulation. It's basically like acupuncture, but modern-day acupuncture. So we literally put a little needle next to the nerve in your ankle, and we stimulate that nerve, and that helps modulate the messages to the bladder. You might say, how is that possible? Well, the nerves that control your bowel and your bladder actually start in your lower back and travel all the way down and end in your ankle. So when we put that little needle in, we can modulate the messaging to your bladder. The success rate of that is in the range of about 70%. And remember, these are for people who are refractory to first and second line therapies. The downside of that therapy is that you have to come in every week for 12 weeks, and then once a month thereafter for maintenance. But now there are some newer techniques on the horizon where we can implant a little coin about the size of a nickel into the ankle. So that's the newest, hottest thing. The second is botulinum toxin A, which is Botox. It's the same Botox people put in their faces. We can put it in your bladder. Success rate about 80%. It lasts in the range of about 6 months. So every 6 months, just like going to the dentist to get your teeth cleaned, you come in and get your Botox injection. We do it in the office under a local anesthesia, and you can drive yourself. So that's a great option. And then the third therapy is a pacemaker for the bladder. The same technology as pacemakers for the heart, made by the same companies. It's called sacral nerve stimulation. We actually put a little lead or a little wire next to the nerve that gives your bladder sensation and function. Same nerve that you stimulate with PTNS. It's a battery about the size of an Oreo cookie, and we put it in the lower part of your back under local anesthesia. The battery life lasts about 10 to 15 years. The nice thing about that is you also get to take it for a test drive before you get the actual one put in. So we'll put the little leads in, and you wear a temporary battery in a little belt around your waist that nobody will know is there. If it works, which it does in about 9 out of 10 people in our hands here at Houston Methodist Hospital, then you go to the operating room to have the permanent Oreo cookie-sized battery placed underneath the skin. So the good news is that we've got a lot of great options that are available to treat overactive bladder these days. And so please ask your doctor about it, because there are things that we can do to affect this quality of life issue.